Hi, this is DeQuindra Blakey, FMP. Going to be talking a little bit today about your Medicare annual wellness visit. So, this exam or this visit can bring in a substantial amount of money to your practice, depending on how many Medicare beneficiaries that you see. And it's important to know the difference between the coverage of different exams so that you don't miss out on your reimbursement and that your your patient doesn't miss out on that benefit. So there is a welcome to Medicare exam. This is just for people who just received the benefit, just became Medicare eligible, and that's a one-time exam only. So you want to make sure that you get that when you have people that are new to Medicare. This is initial. It's also called initial preventive physical examination. You're going to review all of their medical and social health history, and you're going to do preventive services education. You're going to give your patient a printed out, individualized plan for any recommended screening that they need for the next 5 to 10 years. And with this, there's no copays or no deductibles that apply as long as you don't do any other chronic illness management with this visit. If you see them for, say, a hypertension or something that you're treating, then the copays and the deductibles will then apply. So be careful with what you combine with these different exams. Your annual wellness visit is your visit to update your personalized prevention plan, and you also want to do a health risk assessment with this visit. This is covered only once every 12 months. The person would be eligible if they had not had that exam within the last 11 months. And the patient does not have to pay for it, and the copays and deductibles do not apply unless you address a chronic illness at the same time that you do this exam. And also, um, just if there's any question, a routine annual physical Medicare does not pay for at all, and a patient will be responsible for paying 100% of that cost. Okay. So, in order to find out if your patient's eligible or not, you would need to contract your local MAC contractor, or you can go onto your Medicare portal, the voice response section. You can call, or you can go on the portal and check to see. It will show you when was the last date that the person had it. So if it's been 11 months since then, you're eligible to bill that service. And those patients, you don't have to be the primary provider to bill for most of these preventative services, including your annual wellness. You just have to be offering primary care services. It has to be done in a primary care location, so it can't be done in a hospital or surgery center or in a specialist office. So your a primary care provider can offer this service to any Medicare beneficiary. Okay. Each annual wellness visit includes a health risk assessment. So you want to do um, get some self-reported information from the beneficiary, and you can have the person fill out the papers themselves, and before you start your visit with them. And so at minimum, you want to get demographics from them. You want to get them to do a self-assessment of what their health status is, and a self-appraisal of psychosocial risk, behavioral risk, their abilities when it comes to their ADLs. Are they able to dress themselves, bathe themselves? How is their walking? You want to look at these things and be able to determine if they're fall risk and things of that nature. You also want to do um, have them tell you about their instrumental ADLs, including whether or not they're able to shop for themselves, if they're able to clean their own house, manage their own medication, their own finances. You want to establish their medical and family history. Um, at minimum, you want to get information about their parents, their siblings, their children, uh, focusing on things that may be hereditary or put them at increased risk. You want to get the past medical and surgical history, if they've had any illnesses, any hospital stays, operations, allergies, injuries, different treatments, what medications they take, including supplements like vitamins and calcium and things like that, herbal remedies, which a lot of our patients do and will not tell you if you don't specifically ask. And it's recommended that we pay uh, particular attention to if our patients are taking opiates and assess them for opiate use disorder during this time. We want to get a current list of any providers that our patients are seeing and any suppliers, like if they are receiving any durable medical equipment. We want to get our vitals, our height, weight, our blood pressure, our BMIs, and whatever other measurements you feel might be necessary, like blood glucose if they're diabetic. You want to assess them for any cognitive impairment. So you want to do direct observation, and you also want to involve family or caregivers if they're present. You may want to do something like a mini cog test or something of that nature, a mini mental status exam. You want to review their potential risk factors for depression, including current or past experiences with depression or other mood disorders such as anxiety. So you may want to do a screening. You want to do maybe your PHQ-9 for depression, or if you suspect anxiety, may want to do a GAD-7 at that time. You want to review the beneficiary's functional ability and their level of safety. So you want to use direct observation of the beneficiary, and you may want to do another screening or a little short questionnaire that assesses their ability to perform their ADLs, their fall risk, and check their hearing for impairment, and try to determine how safe they are at home or if some intervention needs to be taken in the home. And finally, you want to establish a written screening schedule for the beneficiary. As I mentioned earlier, a checklist for the screenings that they would need for the next 5 or 10 years. And these are based on the United States Preventative Services Task Force recommendations and the Advisory Committee on Immunization Practices. Okay, so you want to look at the beneficiary's health risk assessment, their health status, the screening history, and their age-appropriate services and screening that are covered by Medicare. Establish a list of their risk factors and the conditions that they have, and what primary, secondary, or tertiary interventions are recommended or are already underway, including mental health conditions, including depression, substance use disorder, and cognitive impairment. Risk factors or conditions identified through that initial preventative physical exam, and treatment options or their associated risks or benefits. You want to furnish the beneficiary with personalized health advice and appropriate referrals if they need health education or preventative counseling services or programs. So you want to include those things aimed at community-based lifestyle interventions to reduce health risk and promote self-management and wellness, including fall prevention, nutrition, physical activity, tobacco use cessation, weight loss, and cognition. Also, furnish at the beneficiary's discretion advanced care planning services. You want to include a discussion about future care decisions that may need to be made and how the beneficiary can let others know about care preferences. Caregiver identification is very important. Who do they want to take care of them when they get to the point that they are unable to do it themselves? And you want to explain advanced directives, and you may just have the conversation, or you may actually assist them with completing forms or direct them to someplace where that can be done. Now, that is for your initial annual wellness visit. Also, don't make the mistake of missing out on money. Like I said, make sure that you get that Welcome to Medicare exam. And after that, within that next 12 months, you get that initial Medicare exam. And after that, you build the annual, because one mistake a lot of providers make is that they will do the Welcome to Medicare, and then after that, they're billing the annual. You missed your initial preventative physical exam, and that is a benefit that beneficiary will not be able to go back and receive, and it is also monies that you will miss out from bringing into your practice that you will not be able to go back and recoup, and it does reimburse more than the annual wellness visit itself. Okay, after you do those first two, all your subsequent annual wellness visits after your first annual wellness visit, you want to review and update your health risk assessment, and you want to update the medical and family history, the providers and suppliers. You want to get those vitals, and you want to pay attention to any cognitive impairment the person may have. You want to update the screening schedule, the beneficiary's risk factors for which primary, secondary, or tertiary interventions are underway or recommended, and you want to furnish and update the PPPS, the personal preventative plan, which includes your personalized beneficiary health advice and a referral for the health education or preventative counseling services or programs. And you also want to provide that advanced care planning services at your beneficiary's discretion. Okay, so your codes that you will find in your annual wellness and preventative servicing, and your wellness and preventative services ebook, your codes are going to be a GO432 for your Welcome to Medicare. You will have a GO438 for your annual wellness visit, your initial visit, and it will be a GO439 for your annual wellness visits, all of your subsequent visits. Do not miss out on that GO438, okay? All right. So, Medicare Part B covers these annual wellness visits if it's provided by a physician or qualified non-physician practitioner, such as a physician assistant, nurse practitioner, or a certified clinical nurse specialist. It can also be done by a medical professional, such as a health educator, registered dietitian, nutrition professional, or other licensed practitioner, or a team of medical professionals directly supervised by a physician. Okay. When you furnish a separate, significant, identifiable, medically necessary evaluation and management service along with the annual wellness visit, Medicare may pay for the additional service. You want to use a you want to report your annual CPT code with the modifier 25. That portion of the visit must be medically necessary to treat the beneficiary's illness or injury, or to improve the functioning of a malformed body member. Okay, if you do advanced care planning as an optional element of this annual wellness visit, you want to report a CPT code 99497 for advanced care planning, including the explanation and discussion of advanced directives such as standard forms, with completion of such forms when performed by the physician or other qualified healthcare professional. First 30 minutes face-to-face with the patient, family member, and or surrogate. So the 99497, you're actually completing the forms, okay? A 99498, advanced care planning, including the explanation and discussion of advanced directives such as standard forms, with completion of such forms when performed, okay? So by the physician or other qualified healthcare professional, each additional 30 minutes. List separately in addition to your code for your primary procedure. Okay, so I'm going to go back. The 99497. You don't have to actually complete the forms. You can bill for this simply by having this discussion with the family or the patient. Okay. This 99497 or 99498, 99498 is if you go over 30 minutes with the discussion, and this can be billed with the annual wellness visit, but this can actually be billed with any visit. It's not limited to just being done with the annual wellness visit. Okay. All right. And Medicare also waives the coinsurance and the Medicare Part B deductible with the annual care planning, okay, when it's provided on the same day as the annual wellness visit, when it's furnished by the same provider as the person who completes the annual wellness visit. And if you do it with the annual wellness visit, you have to report a modifier 33, preventative services. Okay. All right, so you can get your patient or family to help you prepare for the information gathering for the annual wellness visit. Make sure you ask them to bring with them when they come to their appointment. Make sure you ask them, bring your medical records with you. If you bring your immunization records, you know, you can give them, you can maybe email them or mail them your forms to complete prior to them coming to the facility, so that they can try to have those medication lists with them, or those provider lists. I like to ask them on the form, request the information for the pharmacy that they go to, because I just happen to have a lot of patients that don't know all of the medication that they take. If you have support staff that may go through medications and obtain a med list for you, you can have them call the pharmacy and ask them to fax you a med list, or If you are old school, you might want to ask them to actually bring the medication with them. I find it just takes up too much time for me to go through and write down each medication, so I don't prefer to do that. But it's based on whatever fits your style. Okay. So, some of the other preventative services that Medicare Part B covers: alcohol misuse screening and counseling, bone mass measurements, cardiovascular disease screening tests, colorectal cancer screening, counseling to prevent tobacco use, depression screening, diabetes self management training, glaucoma screening, hepatitis C virus screening, HIV screening, influenza, pneumococcal, and hepatitis B vaccines and their administration, intensive behavioral therapy for cardiovascular disease, also known as cardiovascular risk reduction visit, IBT for obesity, your IPPE, your Welcome to Medicare visit, medical nutrition therapy, prostate cancer screening, screening for cervical cancer with HPV tests, screening for lung cancer with low dose computed tomography, screening for hepatitis B virus infection, screening for sexually transmitted infections, and high intensity behavioral counseling to prevent sexually transmitted infections, screening mammography, screening pap tests, screening pelvic ultrasound, screening pelvic examination, including a clinical breast exam, and ultrasound screening for abdominal aortic aneurysm. You may want to visit Medicare Learning Network's Preventative Services Education tool for additional information, but I will be going over each one of these screenings, preventative services and screenings that are listed in my ebook. I will be making a video to break down those services to let you know what things you need to document and how to code it. Until next time, this is DeQuindra Blakey, FNP.